Diabetes mellitus. What you need to know. Diabetes mellitus is a chronic medical condition where the body cannot properly regulate blood sugar, glucose, levels. It's the body's main fuel, a type of sugar from the food we eat that powers our cells. Insulin is a hormone made by the pancreas that helps move glucose from the blood into the body's cells, where it's used for energy. How it works in a healthy body. In a healthy body, the pancreas releases insulin after eating. Insulin moves glucose from the blood into cells for energy. In diabetes, either the body doesn't make enough insulin, or the insulin doesn't work properly. This causes high blood sugar. Types of diabetes. Type 1. Autoimmune destruction of insulin-producing cells. Usually starts in childhood or adolescence. Type 2. Body becomes resistant to insulin or doesn't produce enough, often linked to lifestyle and genetics. Gestational, develops during pregnancy, increases risk of type 2 later. Why it's important. Uncontrolled diabetes can damage the heart, kidneys, eyes, nerves, and more. Early detection and management are key. Symptoms. Increased thirst, polydipsia, frequent urination, polyuria, extreme hunger, polyphagia, unexplained weight loss. Fatigue, blurred vision, slow healing wounds, numbness or tingling in hands, feet. Diagnosis. Fasting blood glucose is greater than or equal to 126 mg per deciliter. Random blood glucose is greater than or equal to 200 mg per deciliter with symptoms. HbA1c is greater than or equal to 6.5%. Oral glucose tolerance test, OGTT, 2-hour value is greater than or equal to 200 mg per deciliter. Management and prevention. Lifestyle. Balanced diet, low sugar, high fiber, regular physical activity. Weight control. Management and prevention. Medical. Oral medications, e.g., metformin, insulin therapy. Blood sugar monitoring. Treatment of type 1 diabetes. Primary approach, lifelong insulin therapy, since the pancreas produces little or no insulin. Insulin types. 1. Rapid-acting, e.g., Lispro, Aspart, right-pointing arrow controls blood sugar after meals. 2. Short-acting, regular insulin. 3. Intermediate-acting, NPH. 4. Long-acting, e.g., Glargine, Detamir, right-pointing arrow provides steady baseline insulin. Delivery methods. Insulin injections, multiple daily doses, insulin pump, continuous delivery, monitoring, frequent blood glucose checks plus HbA1c every 3 to 6 months. Lifestyle, healthy diet, carb counting, and exercise. Treatment of type 2 diabetes. Stepwise approach starting with lifestyle changes, then medications, then insulin if needed. A. Lifestyle. Diet modification, low refined carbs, balanced macros, regular exercise, is greater than or equal to 150 minutes per week. Weight loss, if overweight, B. Oral medications. 1. Metformin, first-line drug, reduces glucose production in the liver and improves insulin sensitivity. 2. Sulfonylureas, e.g., glipizide, gliclazide, stimulate insulin release from pancreas. 3. DPP-4 inhibitors, e.g., sitagliptin, prolong action of incretin hormones. 4. SGLT2 inhibitors, e.g., empagliflozin, increase glucose excretion in urine, also heart, kidney benefits. 5. Thiazolidinediones, e.g., pioglitazone, improve insulin sensitivity. 6. GLP-1 receptor agonists, e.g., liraglutide, slow gastric emptying, promote satiety and lower glucose. C. Injectable therapies. GLP-1 receptor agonists, weekly or daily, basal insulin if oral agents fail to control HbA1c. 3. Treatment of gestational diabetes. First line, diet and exercise modification. If uncontrolled, insulin therapy, preferred for safety in pregnancy. Oral agents, metformin or glyburide may be used in some cases. Monitoring, frequent blood sugar checks to protect mother and baby. Special considerations, blood pressure control, often with ACE inhibitors or ARBs. Cholesterol control, statins if high cardiovascular risk. Aspirin, for high-risk patients to prevent heart disease. Foot care, Regular exams to prevent ulcers and amputations. Eye exams, yearly screening for retinopathy. Prevention. Maintain healthy weight. Stay active. Avoid excessive sugar and processed foods. Stethoscope rapid review, diabetes mellitus. Definition: a chronic condition where the body can't regulate blood sugar due to problems with insulin. Types: Type 1, no insulin, autoimmune. Type 2, insulin resistance, reduced production. Gestational, during pregnancy. Symptoms: thirst, frequent urination, hunger, fatigue, blurred vision, slow healing. Complications: heart disease, kidney damage, eye damage, nerve damage, foot ulcers. Diagnosis: fasting glucose is greater than or equal to 126 mg per deciliter, HbA1c is greater than or equal to 6.5%, OGTT is greater than or equal to 200 mg per deciliter. Treatment: Type 1 right-pointing arrow insulin for life. Type 2 right-pointing arrow lifestyle right-pointing arrow meds right-pointing arrow insulin. Gestational right-pointing arrow diet and exercise right-pointing arrow insulin if needed. Extra care right-pointing arrow BP, cholesterol, eyes, feet. Prevention: healthy diet, exercise, weight control, no smoking.